Good morning and welcome to Smart Cities Council's webinar on how Asian cities are coping with COVID-19. We are struck by lightning or such an event that has disrupted our lives completely. I think in probably in 100 years, people only cite the flu which came in the early or Great Depression or the World War, which sort of is drawing up to draw a parallel with the kind of disruption this event has brought in. But there are cities are trying to cope with it, and there are multiple experiences and ways that they are coping with it. And we've gathered a illustrious set of experts here on the panel, and we will engage them into a discussion so that you can have the best out of their knowledge and experience. Okay, so we have the panel includes the likes of Mr. Manojit Bose, Smart City expert from Pune Smart Cities, Mr. Casey, Chairman Smart Cities Network, Mr. Yudi from Jakarta Smart City Office, Mr. Vikash Chandra from Smart Cities Mission, Ministry of Housing and Urban Affairs, Mr. Rajendra Bhatt, District Magistrate Collector, Bhilwara, Rajasthan. So Smart Cities Council is a global body which believes in livability, workability, sustainability. And we have been for the last 6 years in India serving along with the Smart Cities mission to create clarity, assist by bringing out the India Readiness Guide, and so on and so forth. Our company also publishes Construction World, a magazine which has been there for the last 22 years plus, and the largest circulated magazine and sent across 800 cities in India and overseas. Our panel, as I just mentioned, okay, now we have a poll question coming up. We want to know which country you think that is the one that is actually handling the COVID-19 pandemic very well. This poll will come to you in a panel beside your screen. So I would encourage all attendees to select which you have to just name the country which you think is managing this pandemic very well. So we have only put 6 countries here. We have India, Singapore, China, Vietnam, Indonesia, South Korea, and you got to select which one of these is the one that you think is handling this very well. We just want to get a sense of the house. Okay, I think maybe we can, let me just, before we go on to that, just a minute. Just to, I'm just fixing, there is a technical fix here that I'm just looking at. But meanwhile, there is an interesting slide that I wanted to take you through before that, how they think that this whole pandemic is going to pan out over what period of time, because it's not going to go away in a hurry. And so if you can see this graph here, it shows you that the whole peaking of the pandemic cases has already happened. We are in the midst of it. This is of course for US. April and May, the all cases have really spiked up, and gradually, obviously, the lockdowns and various other trial tests, testing capacity is going up gradually, availability of medical care, etc. Then therefore copes up with the needs, and you see a declining curve there. But then if you see schools reopen around September and people return to work July, August, and then we see there is a potential vaccine for healthcare workers, which is estimated to be around October 20. But after that, you see in November again, there is another wave of infections that spikes up and takes you nearly to the half of that level of the previous one. That means that is a potential second wave of infections, because the vaccine is not available to everybody in the market. And then gradually the curve declines by March 21, when the potential vaccine is broadly available to all. So that's what the generally there is a sense amongst this is a research by Morgan Stanley which has been there. So coming back to the poll, I think we've been able to fix the glitch now, and you can now vote for which country has been most effective in controlling COVID-19. Okay, let's move on to the agenda. Let's get a sense of city update from our panelists here. Can we start with Casey? Casey, could you give us a sense of Singapore is again into a second lockdown, and we believe that Singapore is one of the prime movers in this whole pandemic, and in terms of controlling and being very organized, and the residents are also very, very adhering. So could you give us a sense of what's the update there? I have a slide for you which I'll just put up, and yeah, Casey, please come in.
Okay, thanks a lot, Pratap, for the opportunity to be part of this Asia-wide sharing. I have on the slide, you can see that there are some lessons that Singapore has written to the Journal of Travel Medicine back in March, in which it has outlined the 6 main measures of communication, the policies, and the enforcement measures. I think from January, when we were all alerted by this COVID-19, which originated in China, Singapore was one of the first few to put in measures in different areas. They have firstly a multi-ministry task force. We then have measures to have border controls to ensure people who enter into Singapore are sort of put into quarantine. We have healthcare measures that allow 800 public health preparedness clinics to be doing the testing. So right now, as Pratap has said, earlier this week, the Prime Minister announced an extension of what we call the circuit breaker. And the latest numbers from Singapore as of yesterday, unfortunately, we had a gap in our society whereby the dormitories of the foreign workers, where we have a few 100,000 of them in Singapore, there was a community spread of sort. So most of them were young foreign workers. They are healthy, and hence, although the numbers are huge into the 10,000 now, the fatality rate in Singapore is only 12. So in that regards, I think the government is putting in measures to ensure that the community spread is contained, and within the areas where the dormitories are now isolated, and all foreign workers, almost 500,000 of them, are put into total lockdown. So we are at the lockdown is still the 1st June. So we are all mostly only very essential services are operating, like the banks and like key food services, and the supermarkets are open. So that's my brief update, Pratap. Thank you.
What about e-commerce? Are you getting to order, commodities across Amazon and other various other e-commerce platforms?
Yeah, certainly a lot of people have no choice but to go into e-commerce to get delivery done to their homes, and there have been a exponential increase of people who to do delivery services, and in fact into the thousands of people who applied to be Grab drivers and riders, and as well as delivery personnel. So certainly e-commerce has got an exponential boost during this period.
Okay. Can we go to Manojit? Manojit, can you give us some sense of what's happening in Pune? Pune and Mumbai both are in hotspots.
Yeah, thanks, Pratap, for giving me this opportunity. And yeah, I mean, you're right. I mean, Mumbai and Pune have been one of the more critical hotspots in the country, if you will. I mean, so in Pune, the number of cases are around 780 plus, and a lot of measures have been taken by the district administration as well as by the smart city special purpose vehicle. So one of the key things which has been done is that the command and control center is being used as a war room, basically. This command and control center was set up as part of the smart cities mission. And GIS tracking, heat mapping technologies are being leveraged extensively to track not only the patients, but even the quarantine cases, community surveillance, etc. Variable messaging devices, public address systems, all installed as part of the Smart City Systems initiative, are being leveraged extensively for creating community awareness and awareness within the people. Along with that, a mobile app for tracking of home quarantine citizens has also been developed and is being used quite extensively. There is a mobile dispensary van which has been pressed into service. There are around 11 of them which are active all around the city as we talk. And a whole lot of flu clinics are being basically set up and have been operationalized to, at least to make, or rather provide a kind of initial check for people who may be suspected of having some kind of a flu symptom. So they can go to the flu clinics, and further to that, if there is any further kind of treatment which is required, then they are diverted to the hospitals and other places. So this is, in a nutshell, I mean, the gamut of, efforts which have been undertaken by the administration to curb the spread of the coronavirus pandemic.
Okay. Now we go over to Indonesia, Mr. Yudis. I think, Yudi, would you tell us what are you all doing to control Indonesia? Because so far, compared to the population, you are still maintaining a decent level.
Okay, good. Thank you, the moderators. So I would like to give you some brief information what we're doing from the Jakarta side. But before, I would like to give you some very briefly information about the data monitoring on COVID-19 cases in national level and in Jakarta. You can also check those information on the corona.jakarta.go.id, but also you can also check in national level on the COVID covid19.go.id. But so there's a confirmed cases in national. So now we have more than 7,000 confirmed cases, including in intensive care, recover, and death. Regarding to Jakarta, so only for Jakarta, we have more than 3,000 in precisely 3,500 confirmed cases. So this is just a brief information. So what we are doing to mitigate the COVID-19. So in terms of lockdown, so Jakarta now established a large-scale or semi-lockdown social restriction. So it's already done or almost a month, but in overly it's like it's so we need to make it those initiatives more effectively. So this policy is basically carried out in accordance with the central government regulation through the Ministry of Health. So through this policy, Jakarta government so limit the activities of citizens by implementing work from home and also learning from home and also worshiping from home and so forth and so forth. And so there is many cases happening in Jakarta, but also having said that, there's also limitation. But we are trying to do our best by doing testing for other people who are priority to test. Let's say, for example, at the moment we are still focusing on the conducting a rapid test. It's like RPT, rapid test, that we can get from the central government. So we have a quota for rapid test from the central government as an initial step before conducting a swab test to find a new cases in Jakarta. So so we are currently continuing our effort to increase the testing capacity through the Jakarta government through the Department of Health Office. So and in terms of the contact tracing, so from national level, we have also built the application. It's I think similar like Trace Together in Singapore, but so this app is basically it's managed by the central government, not managed by the government of Jakarta. I think that's it.
Okay. Let me go over to Mr. Vikash Chandra now, who's representing the Smart Cities mission here, and he's obviously got a wealth of information on all cities collectively. Mr. Chandra, could you throw some light on what's the update?
Thank you, Pratapji. Sir, we are almost in the 30th day of the lockdown, and something has been working for the Indian cities. Around 13th of April, we were around 10,450 confirmed cases. Today, we are around 21. So we can say we have doubled in about 10 days. So actually, we have kind of been able to slow down the infection. It is still, we are in a war-like situation. It is still a disaster ongoing. So there have been some initial success, but we have to be cautious when we kind of work out. Now, as you're aware, there are 100 smart cities, and they, for the last 5 years, they have been having a regular interaction, and they have become more proactive in use of technology in district administration. Now, they are not only the bigger cities like Pune and Ahmedabad and Surat and Chennai, but they are also the smaller towns. Now, the best thing which I can kind of inform you is that there are about 45 command and control centers which are operational in this country. And each of them, they actually rose to this occasion and to the challenges which are being present in the country. And each of these 45 command and control centers, they have become the war rooms. And right from mapping each and every confirmed case, mapping their entire journey, the number of people they could have infected, all those people who are confirmed cases, all wards to self-quarantine, where are they located, a spatial map. So entire kind of thing has been worked out, right from effective kind of lockdown, implementation of lockdown, to maybe food and supply, and to providing telemedicine and other kind of innovative things, cities have rose to this situation, and they are using technology in basically helping people. So that is the update in the 100 smart cities in the country.
Right. So before we go on to Mr. Rajendra Bhatt, I want to now welcome Dr. Dubey from Sydney, who's joined in from Sydney. Dr. Dubey, would you like to just give us an update on what's happening there now?
Thank you, Pratap. My apologies, I got a little bit delayed. The quick update from Sydney is our curves are certainly flattening. As of now, I can give you some clear numbers. But before I give you a number, I just want to give you a little bit of a context, because we are relatively very small population. So our state, the entire state, is only about 7.5 million people, which is probably not even 1/4 of some of the cities we are talking here. Sydney, by and large, we have got about 5.2 million people in the Greater Sydney. So in context of the cities, please remember our cities are relatively very small population. As of today, we have got about 2,976 confirmed cases. By the developed world, from the OECD countries' data, this is a very low level of confirmed cases. We have so far tested about 178,000 people in the city or the Greater Sydney area, and our numbers as of the lost lives, human lives, sadly is sitting at about 33 as of today. So our numbers are looking relatively very controllable at this point of time. Our biggest concern is how do we contain the activities so that we can prolong the flattening of the curve for a much longer period of time. But so far, two things I want to highlight which has worked very effectively, and I think number of other cities, and I must congratulate a lot of cities and the federal government in India for doing that, that the leadership has played a very important role in this. The leadership at the local level, at the state level, and certainly at a very high level at the federal or what we call at the national levels. So in Sydney, our premier, or what you call the chief minister of our state, has been an excellent leader in providing a leadership in flattening this curve. But what we feel very comfortable to say that we are managing the situation of 2,976. I'm looking at the data as we get the live data feedback of these people confirmed cases in a very nice and very holistic way. So the news from Sydney so far is our curve is flattening and we are prolonging it, and we haven't put our lockdown in a very hard way, unlike European cities and stuff. So we still have a relative economic and business freedom to do things.
Right, you have an advantage there. You have an advantage there because of the lower population. Let's take us to Mr. Rajendra Bhatt, who will tell us about the Bhilwara model. Bhilwara is, I think, Mr. Bhatt, would you please come in and tell us about this?
Yeah. Bhilwara, first of all, I want to thank you all and for giving me this opportunity to present the Bhilwara model. Bhilwara model is nothing. Bhilwara is a small city, a district in Rajasthan state of India with a population of less than 3 million. That is, we call 27, 28 lakhs. And the city population is nearly 5 lakh, and the rural population is nearly 24 lakhs. So it is just 30 lakhs or 3 million people here. And actually, what happened, it was 18th night and 19th morning when two cases, positive cases, came to our notice. That was, the test was positive, and these two were the doctors here of a leading renowned hospital. And these doctors, during their period of this 14 days period we call, when they were infected, they were seeing lot number of patients, nearly 7,000 patients in the hospital and 3,000 or more patients at home. The hospital patients record we obtained from the hospital, but the home at home they have seen 3,000 or more people. The record was not available. So 10,000 or 11,000 people uh, in the city, in the district, moving around, who were in the contact with these two doctors. The community spread was written on the wall. It was clearly seen that anything could happen. How many people now from there are trains, there are buses going out. The people who have met these doctor, consulted the doctor, may go out and spread it in another district or another. Is my voice clear?
Yes, it's absolutely clear, sir.
Yes, clear.
Please go ahead.
Okay. So this was a realm of uncertainty. So what we first did, uh, actually people call it now a model, because it was an exercise how to contain and how to stop a community spread. So this included, now we can say systematically that this included 6 steps. At that time, first, we thought that nobody should go out from Bhilwara and spread it elsewhere, and nobody should come to Bhilwara and get infected. So, first thing was to seal the border. That was isolation of the district. Now, I tell you the stats. On day 18th and 19th, we got one patient in the night and one in the morning. Then till in 19th evening, we got five. We knew five positive cases. Then on 20th, 9 cases. Then 3. Then 13. So these numbers rise continuously until 29th. That is in just 9 days, we had 26 positive cases, and we had limited test facilities. So there could have been more, but we had limited test facilities. So what we did on the first day, that was the curfew was imposed under section 144 of CRPC in Bhilwara city. The curfew were in 2 phases. That was phase 1, when the essential services were open. The kirana shops, the small convenience stores, they were open, and the medicine shops were open. And the second phase was a total shutdown. We closed everything, and everything was provided to all the city people through home delivery. So we sealed the borders immediately. 19th and 20th, what we did is seal the borders immediately, and seal the city borders, so that nobody from city, as city was the epicenter, so nobody from city should go to the rural areas. Nobody from rural areas should come to the city. And then district border was sealed, and the DMs were told that the DMs of the neighboring districts were told that please, you also seal your borders with Bhilwara, because we have now these two doctors and many more nursing staff and other doctors who are infected, and things are going to spread. So your borders should also be sealed, so that there should be a double check. So that was a double check system, and all those DMs also sealed the borders with Bhilwara. There, I requested our Chief Minister, Shri Ashok Gehlot, to I told him that I have written to the railways and roadways to stop. Kindly, you also tell them to stop, and he immediately responded, and the railways were stopped, and this is much before the lockdown of India. That is, it is nearly 6-7 days before, and the movement of private vehicles was stopped. So district was on a complete lockdown, and you can say a very hard lockdown. Nobody was allowed to come out of the house. Only essential things were open in the first phase, that is till second. The circles were made in front of these essential shops. People used to go and stand in those circles and took the ration and medicines in a line. And what we did was we marked the epicenters. epicenters means the hospital was the epicenter first, was the first epicenter in the city. The containment zone of 1 kilometer radius from the hospital was made. That was made no movement zone. Nobody was allowed to come even outside the gate. And there was a buffer zone made that was 3 kilometers. These two were the no movement zone, where sanitation and everything was going on continuously. These were the localities of the positive cases which were near to the hospital. So we did a cluster mapping. We took many maps of the city. Then we used to, pin down the places where the positive cases used to come. We identified the areas. There were 6 such areas from which these cases were in clusters. Those 6 areas were identified. Special teams were deployed for continuous screening and of the suspected cases. Disinfection was continuously going on. And this is what I'm telling you is 19th and 20th. These are the 2 days in which all these exercises, 300 teams were made to screen the whole city, because we were not knowing how many patients these doctors have seen at their homes. So screening was done by 300 teams, which had one member of medical and health staff, then another was a teacher, then another was from any other department. They were there's a swine flu team here in our districts, which is expert in doing all kind of surveys and screening part. So they were made master trainers, and they trained the other staffs, other people of all the departments. So 300 teams were made, consisting of 3 persons. Ashas were there, then Asha workers, then Anganwadi workers, they were also involved. And door-to-door survey was made. This survey started on 18th evening itself. Then for rural survey, this is the location of positive cases in Bhilwara district. These are marked by the red points are the positive cases. And where you find a cluster, that is the city area where you find a maximum number of cases. Then these are the samples we collected from the city area, from all those places, so that we could come to know that where we have random sampling is left. So we wanted to ensure that it is not a community spread. So we were taking samples from everywhere, and our CSCs are there in villages. So everybody having ILI type of symptoms, that is flu type of symptoms, we used to take samples. As well as there was 1950 rural teams which were constituted. And these rural teams, what they were doing, they were also surveying door to door. We have 1910 villages in Bhilwara, and 1950 teams were made. And these teams also constituted of three members. They used to go each home, ask. There was a format, and there were 2 formats given to them. One, anybody has gone abroad, because the COVID is not, it is not indigenous. It is not in India. It has come from some country or some place to India. So anybody has gone abroad, or in last 1 month, or they have received somebody from who has traveled. So travel history was taken. Then his health history was taken. Then another thing was whether he has shown in any hospital, or the Bangad hospital, which was a private hospital, which was the epicenter, have they shown in OPD, or have they ever been admitted there. So this was all a tedious part, because we could not do so many tests at a time. We could not do screening at this much people at a time, because we didn't have guns, that thermal guns to see even the temperature. So these all nearly 6,000 people in the village to village, and they were given the specified time schedule, that in this time today you have to do 80 houses of this village, and which were the bigger villages, that more than 2 teams were placed. So what was happening is, every day we used to get these number of people in the survey has some flu type of symptoms. These were the people who had shown in the OPD of Bangar. So they were home quarantined. They were quarantined at their homes. A sticker was placed on the homes, and the local people near their homes were told that now they have quarantined. This is the gravity of the situation. You have to see that they don't come out of the houses. All the requisites, whatever they need, their needs are to be fulfilled, and all the material has to be supplied to them at their homes only. Nobody is going to come out from this home. And those people who were designated as watchers were termed as corona fighters, because this was a war which we were fighting. So they were termed as corona fighters. They were the retired teachers, retired persons, or the important persons of those villages. They were also there. So these local people managed their movement, restricted the movements of the people who were. So in the first survey of the rural area, nearly 23 lakhs, that is 2.3 million, you can say, people were surveyed in 7 days, and 14,000, more than 14,800 people were home quarantined, and their movement was restricted by the local people, which were corona fighters. Now, these corona fighters used to report to our SDMs and BDOs at subdivision level. They were known as our corona, captains. So they in turn gave the information to the district headquarters, which was the incident commander place here. So this was the team which was, taking care of in all the villages. And in city area, there were all the hotels, 27 hotels, were acquired, and they were made quarantine centers. So nearly 2,400 people in the city were, out of them, nearly 15,141 people were there in the quarantine center the first day, because the hotel capacity was this much. Then rest were home quarantined, and in city also there was a monitoring system on them, which used to monitor and tell. And there was an app also. Now we have loaded the app in the smartphone in the city area, but in rural areas many people don't have smartphones. So this whole exercise was done. And the screening in city, as city is the epicenter, 4 times screening of everybody has been done. Now we have done nearly more than 7,000 tests, and all these tests, out of this 33 are positive, and two of the persons died, and because they were already admitted in the Bangar hospital in ICU, and they had multiple, one was in coma and the other has a renal failure. So the death main cause was not COVID, it was and other 26 people have completely recovered. Our medical team has done excellently well. The 26 people are now virus free, and they have been discharged and they are at homes, and 5 are remaining, positive. And their first report of all these 5, out of these 5, 4 reports have come, first report negative. So in near future, I think these 4 also in 14 days, they will be also, and one thing which I forgot to tell you, our all the private hospitals, major private hospitals, we acquired them also, because our district hospital was made as COVID-19 hospital. Then all the, these hostels and other places were also acquired, so that we now have a capacity of nearly 15,000 quarantine beds, and out of which 1,541 are hotel single rooms, and other are those hostels and other facilities. So this is, and people are still, from 20th till today, we have a curfew. People are not coming out. So what we are seeing is our graph. First, we were expecting in first 14 days nearly 100 to 150 patients, and in second 14 days to nearly 500, and in this 14 next 14, nearly more than 1,000 2,000 cases. But we were able to contain them from 26 in first 7 days till today. That is, in a month it is 33, and out of those 33, 26 are discharged with no virus, and 4 are again negative. So only one which is left positive in 14 days. Let's see what will happen. And that patient is also in
Right.
Jaipur, so not here. So this was the whole plan with 6 basic crucial, that is a ruthless containment strategy: mapping of isolation of district, mapping of hotspots, door-to-door screening, aggressive contact tracing, and ramping of quarantine and isolation wards, and monitoring mechanism for rural areas. This is
Thank you.
basically what you call a strategy.
And thank you, Mr. Bhatt. I think that is quite an exhaustive. I think you all have been really the corona fighters in that sense. And, India has the complexity of the rural and urban being side by side. And then we have very high density. And then we have people who have very sophisticated kind of living. And then we have absolutely people with very, very basic living. And all this combined together makes the task even more difficult. But I think Bhilwara has set an example for the rest. Let me just get the audience to come back to our poll. It is going to be on your screen now, finally. Yeah, so we had given choices of five countries: India, Singapore, South Korea, Indonesia, and Vietnam. And we were asking which country has been the most successful in controlling this pandemic. And nearly 50% of the people feel it's India, 30% feel it's South Korea, and 16% feel it's Singapore. So that's the sense of the house, that India is 50%, followed by South Korea, and third is Singapore. But I think the panelists may know that probably Vietnam is actually the one that's been able to really control this much better than the others. We go on to the before we take on the next poll. Okay, we can take the next poll as well. Which technological facility would be most useful during a pandemic like COVID? So you have to choose which of these. So CCTV, command control center, drones, remote video medical counseling, or drive-in testing facility. I think these are the 5 options that are provided to you, and you have to just choose which do you think is the most the best technological facility, which you think would be there. And I think Mr. Vikash Chandra also said comprehensively a lot of these activities were deployed in various cities.
In fact, I can tell you
Yes.
that
Yeah.
this might be a health disaster, but primarily it has got an administrative solution. Now, administrators like Mr. Bhatt, we are so proud of them. He has done wonderful, and the way he explained the entire, because he would have never faced such kind of a situation of this proportion. And the way he has handled, the way cities have become kind of rose to this occasion. जैसे कहते हैं कि a child becomes a man in a moment. So these kind of situations actually bring that kind of development.
Right, Mr. Chandra. So the results are in, and then 43% feel that drive-in testing facility is the best possible, technological intervention, followed by command control center, which is, and then it is followed by remote video medical counseling. These are the 3. So CCTV actually it's really down the preference, as people perceive it to be. So drive-in testing facility, which has already been operational in Mumbai and in 2 places, I think also in Delhi. is what is being sought. Okay, let's moving on to the agenda next. We have, technological innovations are also being done by startups. In India, we've got startups which have done artificial intelligence based they monitor people via real-time alerts and see if they're wearing masks or if there are any health risks. Using thermal cameras, they can find and send an alert in case of high fever to monitor the symptoms. Then there are drone-based solutions which support police and urban local bodies for effective and efficient management. And at a time, 30 to 50 drones can be deployed at any given location, and it can send accurate image back to the ground station that can help the police take stock of the situation. There are also contactless and wireless thermal sensors and images that measure the temperature data of individuals, even a group, a crowd, and it can, through a drone, you can actually work out the thermal, monitor the temperature. And there are also wireless technologies which will minimize the exposure of healthcare workers. We are seeing that a lot of our healthcare workers are at risk. So they are providing them information at record speed. Spraying of disinfectants by drones, which are harmless to humans. So that is essential. That this is also some startups have done. Supply and delivery of essential medicines through drones again. Surveillance, live imaging, computer vision, then developing large-scale thermal scanning glasses. So even at 3 meters and 5 meters, you can be wearing those glasses and you can know whether the person is infected or not. So tackling of community infection by disinfectant sprayer with motion detection, auto spray capabilities. This disinfectant is equipped with temperature scanning and early warning, UV surface and all. So there are plenty of startups are doing great amount of work, and I think that brings me to the question on technological interventions. And I wanted Vikash to Mr. Chandra to sort of tell us what, in terms of technology, what are the various areas that we have been able to demonstrate in our fight against COVID.
Actually, there are many, but let me give you a few examples. For example, these command and control centers becoming a war room. Now, what they did was that there is one facility available where you have got eyes all across the city, and you are able to ensure that people are not kind of coming out. Now, if you see two people, the police is informed, the police goes in, they kind of ensure that the people are not there. Now, you have to, that is the first thing, that lockdown, people stay in home. The second thing, that there are people coming from different locations. Some people, lot of people initially were the people who travel from outside, they got confirmed of COVID. Now they transmitted them to their immediate family members. Now that kind of finally went to some of the health workers and somebody who came in contact with them. Now each of these people, what is the source of an infection, which part of the city they are located in. So that entire thing, if you put it on a map, it basically helps you create containment zones like how Mr. Bhatt was explaining. Okay, which part of the city has got the congestion? So all those kind of spatial maps, dashboards are being created by these technologies. Now, every day in this kind of a situation, you get new kind of challenges. For example, a lot of people migrant labor started moving home. Now, they were asked to stop where they are. Now, if you want them to stop, they need food, they need some shelter. Now, we have to kind of find those locations, put them with lat and long, where are these facilities kind of organized. So a lot of health workers were getting exposed to COVID patients. In fact, that is a kind of quite a big concern, because one patient, when he gets, one doctor, when he gets a COVID positive, the entire team has to be quarantined. So the idea was, can we use technology to get in touch with the patients? So for example, video conferencing facilities by the doctors to the patients, to those into isolation was, because at this moment, everyone has got questions. And those questions need to be answered. So these technologies are being used. Now people want food to be delivered in their homes. People want medicine to be delivered in their home. So ward-wise, if the cities have created an application, they have started kind of connecting them to the vendors who can supply them food, grocery, milk, medicines. So all these facilities, all kind of cities, not only Surat and Bangalore, but even city like Saharanpur and Aligarh and Agra and Namchi are able to do this. So these kind of technologies the cities are using. There are innumerous examples how cities have used, created an application for interaction among the people into administration and health, to manage the health infrastructure and inventory, to manage, have a direct communication with the patients and isolation wards. So a lot of examples, but challenges are coming up every day, and technologies are and different cities are kind of working out. We as ministry basically help
actually,
the city. Just one line.
So actually what I'm saying, yeah, Mr. Chandra. Go ahead.
Yeah, what I'm saying is that we are basically collating the best practices done by cities and kind of passing them to all others, so that because every city has got a different challenge level. So you understand the situation, you make some kind of a predictive modeling. Today, okay, you are there. So tomorrow the situation could be the worst case this much. Are you ready with the infrastructure? Do you have enough isolation wards? Do you have enough hotels which can be created as containment areas? So all those things are basically mapped in, and it is being worked out.
So the whole smart cities mission, which brought in the need for using technology to decipher data and therefore give what is needed in the areas and cities, has actually been now utilized in such a time, because all the infrastructure that you put together, like command control centers, at least are being put to use. I want to go to Casey in Singapore. Casey, could you tell us some technological intervention which is helping? And please, I think we are running a little short in time, so if you can specifically speak about some technological intervention.
Well, currently the main intervention is testing. So because of the large number of cases in the dormitories, the Singapore government has speeded up a lot of the testings that's been done. So they have to organize a makeshift areas where the testings are done. The other preventive measure through the contact tracing is this app called Trace Together, which is publicly available to anyone else in the world, whereby they uses Bluetooth, whereby they would capture mobile numbers of people who are within 2 meters for about 30 minutes, and at any time that anyone has been tested positive, they are able to do contact tracing very quickly. So I think this applies to everyone else in the world.
Okay, Dr. Dubey, would you be able to add some some keys technological intervention which is helping? Dr. Dubey?
Yeah, thank you, Pratap. First of all, I want to congratulate Mr. Bhatt, and I want to say it because sitting so far, Pratap, away and just relying on the media, the first time I read about your city, Mr. Bhatt, it was basically saying Bhilwara could be Italy of India. This is the BBC article I'm referring it to, sir. So that gave me a very different perspective when we read it from a distance and understand only what the media is giving it to us. Pratap, I want to congratulate you for bringing Mr. Bhatt here, because the facts you have given it to us today, they are just, I mean, I'm surprised WHO is not coming to you and talking to you more often, Mr. Bhatt. This is the facts you have given it to me as an academic. I've written all of them very clearly and I'll translate it. So to me, Pratap, that is the best innovation what you are presenting right now. Connecting people, connecting the word together to understand there's a fantastic 6-step model which WHO should be clearly looking at it on the ground level and trying to see how can we take this. Our next spot is Africa. How can we take this model and take it to the next places where these things are going to come. From Sydney point of view, Pratap, we did something very simple. And this is a very controversial thing as well. We did not close our schools and preschools during COVID. Our schools and preschools were open throughout this whole time, and our leadership purposely did this. So we used a lot of innovation in school education, in a primary school education, in preschools, in secondary schools. And that's where I would say we have got some brilliant examples from our school system, which can be shared around the world. And because of the time and stuff, I think it would not be appropriate to name some of this, but some players like Cisco and some of the major organizations worked so closely with the government during this time. This was unprecedented. So there was an innovation of a different type. But from Sydney point of view, our education is definitely one of the most innovative area during the COVID-19 phase.
Okay, thanks.
Thank you, Pratap.
Thanks. I want to now go to Yudhis. Yudhis, can you point out any technological intervention used in Jakarta which could be of interest to all of us?
Okay, thank you, Pratap. Okay, first of all, so in terms of the technology intervention, Jakarta seeks to continue to improve the technology implementation in coping with the COVID-19 virus. I think this is the first thing that we discovered is like so the Department of Health Office improved the call center services and also began to collaborate with various telemedicine telemedicine startups to receive complaints from residents who had COVID-19 symptoms. But I think what Pak Casey mentioned that we also do like testing. But before the testing, because the limited quota of the testing tool, we working together with some startup to establish what we call the CLM, is a calculator likelihood measures. So CLM is a entry gate for those who want to do the RPT testing, rapid test testing. So we can minimize or we can identify the potential people who get the symptom or who get the virus, who got the cases. So in addition to this, we also do some tracking. Let's say, for example, ventilator tracking, also the tracking bed hotel or the tracking hospital bed, or also quarantine spaces. So basically, but this information basically is for the internal uses for the hospital in Jakarta. So basically, the objective of this application is to analyze the ventilator demand and availability and to track the optimized ventilator utilization. But I think for the COVID-19, the ventilator is a very important things that need to be provided time to time. I think so. Yeah.
Right. Thanks to this. I think on ventilator, there is the 3D printing of ventilators is also one of the startups working on. Now I want to go to Manojit. Manojit, I wanted to take this. I want you to explain that what do you see this future impact on trends in smart cities planning? Is there how this whole pandemic is going to now lead us into a different kind of a look towards planning cities?
Thanks, Pratap. So I have a few observations on this, okay, in terms of how the post-COVID-19 that era could eventually play out, right? So if you would have noticed that the smart city command and control centers have played a pivotal role in essentially transitioning from a very reactive form of governance largely to something which is more proactive. So you could see increased impetus in this transition from reactive to proactive and eventually to a more predictive form of governance by leveraging the command and control center. Digital is going to be the key, and one can expect significant acceleration in adoption of digital initiatives. But then when we talk of digital being the key, one thing which we must bear in mind is a robust ubiquity IT network backbone will certainly become imperative. Today, we have the network backbone in some cities, some may not have it, and some in between where the connectivity is there, but it's a little patchy. That is going to be very, very critical in the days, months, and the years ahead. Third is, as we move towards a low-touch economy, as a lot of experts are heralding it to be, right? Citizen-centric services which a urban local body or the city government offers to the citizen would become increasingly digital. And what we clearly see going ahead is significant investments in leveraging digital for ramping up and improving the efficiencies of the healthcare infrastructure, beginning with the primary healthcare. The fourth observation, which looks very imminent, is can we have urban observatories in all the cities which have been selected as a smart city? At the crux of an urban observatory is the command and control center, right? And today, with all the plumbing blocks in place, if not all, largely the plumbing IT blocks in place, and with data flowing in into the command and control center, it's imperative that the cities start focusing on developing an ecosystem comprising of startups, the academia, to leverage this data for a lot of predictive analytics going ahead. The data exchange will play a critical role in this. So you have an urban observatory, you have an urban data exchange, you have a COE for running high-end data and video analytics, and these will become increasingly important as cities try to transition from a reactive, largely, form of governance to something which is more predictive in the months and years ahead. And finally, this whole crisis is also quite novel in many ways, right? And a lot of experimentation is happening all across the country. Different cities are experimenting in different ways, some of it from a technology standpoint, some of it from other standpoints. There's a lot of repurposing of technology which is also happening. So as is often said, right, that necessity is the mother of invention. It could also be said that necessity is the mother of innovation, and this should hopefully spur a lot of innovation going ahead. What would be, however, required is if the cities can build up the institutional infrastructure to scale these innovations up, and that we see some of the cities trying to already start doing it within the country and even outside. So these are largely the areas where we see a lot of things happening in the post-COVID-19 era. And the COVID-19 maybe is going to be there for a few more months. But then from a scenario planning standpoint, it's important to look at a very different new world which will emerge once the COVID-19 is done and dusted away with. Thanks.
I think we were just talking about the climate change impact, and then we were hit by this pandemic. So I think these are realities now we have to live with and be prepared for. I think disasters are more commonplace than they used to be. So Mr. Chandra, what can you also react to this in future planning of cities? What are the lessons that we can actually learn from this?
In my opinion, basically 4 points. One, that these kind of disasters teach you a lesson. They need you, the urban planners will have to think about different kind of requirements which emerge into such kind of situation. For example, the spaces where if you have to feed the people, all kinds of people, you need community kitchens, you need fresh kind of places for people to stay. You all of a sudden, if a lot of people have to be moved in, so these kind of new urban planning requirements to play with disaster, kind of that is, I think the urban planning will get to add to it. The second is the use of technology and data-driven kind of decision making. Now you need to have a brain in your city. You need to have the administrators will need kind of spatial analysis done. They need more kind of analysis of data so that they can take better decisions. I am sure with kind of a more effective technology, Mr. Bhatt will be twice or maybe 5 times more effective. He will be able to speed and he will be able to kind of scale his kind of intervention. The third thing, I think it is time for this country to trust its local leaders. Even though the 73rd constitutional amendment, it talked about trusting the ULBs, I think we have been kind of hesitant in trusting them and giving them more powers. We'll have to kind of do it. this disaster basically proves that the local leaders are able to kind of live to the challenge much better than people sitting in Delhi or people somewhere else. The last point which I feel is this disaster is okay. The health part might be a kind of slow down. It will work out, but it is basically like a chakravyuh. You get into this and basically work out. But to come out of this chakravyuh, you will have to basically restart the economy. Now, to restart the economy, there are different layers to it. And the solution will have to be much more local. And that is where I feel the empowering the local administrators with technology and data analysis will be very, very critical. These are the 4 learnings in my opinion.
Right. So I think if we were able to not endanger the economy during a pandemic like this, then the restarting of the economy would not have been such a big issue. So let me now go to Mr. Bhatt, because what are the government interventions that you think are needed? Because your hands were sometimes tied, sometimes freed, and you know that what it really takes to make an operation like this happen. So what government interventions do you recommend are good for you, for administrators like you in situations like this?
And sir, we are so proud of you, Mr. Bhatt.
No, thank you very much. But this was nothing. It is, I can explain you with example is a person swimming towards the shore, saw back, looked back, he saw a shark. So he swam so fast, and when he reached the shore, a person with a stop was saying, "You made a record." So it was he was saving his life. So this model is we were saving the community from community spread of this COVID. So this is nothing else. Government has to intervene in many ways. So it's, mainly the medical facilities in each district has to be uplifted, and slowing down the curve is the opportunity for them to elevate the standards of medical facilities at district levels. And this is we some districts in Rajasthan, and I think in many states of many districts in other states also, they are not very well equipped to face a pandemic such as COVID and other things. So it becomes a disaster if things are not controlled. In Sydney or in Australia, you can. It is amazing that schools are going on and people are going on because you have so much medical facilities. You will control that. But here, if it is in the third stage, then we will not be able to control it because we have limited medical facilities, isolator. We have only 5 ventilators in our district now, including when we take these private hospitals, we acquire them, then now we have 30, 40. Now government is giving 30, 40 more. So now still, if we have 100 ventilators in a district, then 100 patients who need ventilators for reviving themselves, or then that type of facility will be available. Today, if 6 people or 35 people need ventilators, then I have to ship them to some other district or to Jaipur. So this is the time when we isolate the district, control it in a lockdown fashion, and we control it. Then it is a time when we can enhance or elevate our medical facilities level.
Right. I think I need one question which I want to go around with everyone finally as to what the panelists think. When is this likely to end? When are we going to, sort of get back to normal, the regular normal? Because I showed a graph right in the beginning which showed that, something like February 21 is what people are expecting finally when the vaccine is available to all. But what does everyone think? So let me start with Mr. Chandra. What do you think?
Sir, your guess is as good as mine. But I feel if we are because it is a sacrifice the country has to give. So even if we are able to sacrifice one more month, let us say the month of May, I think we should try to get back to normal, and we'll face it. But if a 1 month more will definitely help us more preparedness. This will be a long battle, but after 1 month, we should be ready to fight it.
Anujit, what is your sense?
Pratap, the vaccine is easily a year or so away, but there could be a potential cure in the months to come with all the best scientists and biotechnologists at work. But another line of thinking, which is being talked about, is could herd immunity be a little more quicker in resolving the coronavirus community spread? So till the time you have, say, the cure which is getting developed, maybe it will take a few more months. Could herd immunity be considered? That could probably, flatten the curve a little more quicker than what the cure is. But largely, I would believe it's going to be 6 to 12 months before life gets back to normal.
What about you, Dr. Dubey? What is your take on this?
Pratap, our best guess is that it is anywhere 6 to 1 year. But our caveat to all this is, especially for the developed world, that is going to be very challenging for us to bring back to the normal, because there's no normal for us as we see it as far as for next few years. So 6 months to a year's time just to get things moving, but to get back to the normal is an open-ended question, and there's a very big concerns about it. But we're also seeing a lot of positive things coming out of this. For example, you said what could be the best innovation part. I believe what I heard from Mr. Bhatt, there's a huge thing about local administration. How do you strengthen the local administration? And obviously health innovation. I don't think we can run the health infrastructure the way we have been running historically and traditionally. So the health innovation is going to be top of the agenda. But 6 months to a year's time is the best guess at this point of times.
Mr. Bhatt, what is your estimate? You have been on the ground. You're a corona warrior. You tell us.
Estimating time from countries to countries may differ. It cannot be same 6 to 1 year for one country and six months to 1 year for another country. I think the involvement of the people and people, realizing it is more important. In the country where people realize it and wear mask and take all type of protections, then once the major infected people are cured, then 6 months time, 6 months from the cure. That is, if they are cured in 6 months, then another 6 months, people will learn how to behave. Social distancing will be a part of our life, and mask, you will see a world of masks, people wearing masks everywhere. So this will be, I think, for another till 21 December. Then we can say we have contained it in major parts of the world, and let's hope so. But we can't predict. We are not future tellers, but it depends all on us. That is, us means all the public. If the people understand and people take precautions, then this can be contained. And if the people don't take precautions, and once they are okay, they say corona is gone, it will revert, it will come back. If as you know, WHO has told one person can spread it to 406 people in a month's time. So if one is left, 406 and 406, then another how many you don't know. So it is, you have to educate people, you have to make them, it should be a way of life now, wearing a mask and having a social distancing, what I can tell.
Yudhis, what about you? What do you think?
Well, this is very difficult question. I'm not the expert to answer, but I think it depends on the one is a government intervention, and the second one is the citizen participation, because otherwise it's very difficult to predict when the COVID-19 is stopped. But currently, the government intervention in the current condition is needed, especially, I think most of us agree, is limiting human movement. It's like social distancing and so forth. Because I think some like mathematician or some experts said that social distancing can reduce the spread of the COVID-19. But again, it depends on the one is the government intervention and the second one the citizen participation. I think we need to educate the citizen to aware about the COVID-19. Thank you.
Right. So I think we have come to the end of our discussion. I think first of all, let me thank all the panelists. Thank you very much for participating in this. I think there is a lot more discussion that is going to take place, because obviously this is going to be a way of life for the next 6 months to a year, definitely. And there will be many more updates. I think a lot of innovation is taking place. People are finding first there is fear, but then there is hope, and there is the hope. It depends upon how we are resilient, or we are able to come back with some new ideas and new innovations which can actually battle something like this. Uh, just such a big event of this nature is thrust upon us. We should be able to fight back, and like Mr. Bhatt has shown, and other cities are also showing, there are various ways of doing this. So meanwhile, we have our Construction World magazine also, which provides industry updates on the go. You can see on the screen. You can give a missed call on this number, and you keep receiving updates on business and industry updates on what's happening in the construction segment. And our webinars are constantly on. We would like you to continue to be part of this. Thank you very much. Stay safe, stay healthy, and don't go away. Keep coming back to us. Thank you very much. Thank you, panelists. Thank you very much.
Thank you,
Thank
Pratap ji.
you.